Good morning, everyone. My name is Ingo Ilja Michels. I have been working for a long time for the Ministry of Health in the Office of the Federal Drug Commissioner, and later on in a project in Central Asia, financed by the European Union, on the development of better impact for addiction services for people using substances, especially opiates, in Central Asia. But I have also been working in China, 2006, 2008, to get acquaintance with the drug and AIDS situation in China and the development of specific services for drug users, opiate substitution treatment, things like this. But in this project, we are focusing now on social work and strengthening NGOs in the development cooperation to treat drug addiction. This is based on our experiences working in Central Asia and China, but now it's organized by the Frankfurt University of Applied Sciences. And in this university, there are educated social workers with a focus on supporting drug users and helping them to get out of this circle and to improve the health situation of them. So the next slide, please. The goals of this project are based on the Sustainable Development Goals of the United Nations. So there are three main goals of the project. First of all, to organize a research program on the influence of social work on prevention and treatment of drug and opiate addiction, and strengthening and especially looking for the role of NGOs in this field. Secondly, to develop courses and training curricula for social work with drug consuming and addicted people. Many of them are also living with HIV or hepatitis. And third goal is the exchange of young researchers and scientists. They exchange the experiences in the five countries which are working in this program, and with the researchers in Frankfurt and in Germany. And I will go into detail later on this. So next we'll show you our partners in this project. We working together with the Bishkek Humanitarian and now State University in Kyrgyzstan. We have been working and cooperating a long time with them in our project and in Central Asia. And they are educating social workers for a long period. And especially they try to focus this education on social work with drug users. They already organized a course on HIV/AIDS. And now in our project, they want to concentrate on focus on education of social workers working with drug users, which is now mostly done by NGOs, by former drug users in the Kyrgyz Republic. Second partner is the Eurasian National University in Nur-Sultan, the capital of Kazakhstan. They also educating social workers, but they're still in the beginning of this education. And because also in Kazakhstan, they need social workers in these fields. Mostly all these services are done by narcologists, by medical doctors. Now they want to integrate also psychologists, but mainly now also social workers. And that's why we want to cooperate with them. The third partner is coming from Uzbekistan. We are working together with INSAN. This is an NGO focusing on medical purposes, and the Bukhara State Medical Institute. They are educating not social workers, but medical doctors. But we want to focus their studies and dissertation on social medicine, especially working with drug users. Then we will have a partner in the Tajikistan. That's not quite decided because we have had some difficulties to find a university which is educating social workers. Now we are want to cooperate with the Tajik, Russian Tajik Slavonic University in Dushanbe, in the capital of Tajikistan. But they are just starting with educating social work. So we want to support them to implement such a course in the university. And the fifth partner is coming from the People's Republic of China, is the Shanghai Mental Health Center, which is a big center for psychiatry in Shanghai, very modern center, but they're also running a drug service organization and drug treatment service. And they educate their medical doctors at the Shanghai Jiao Tong University, the School of Medicine. And we also want to concentrate on social medicine with them and to help them to find more medical doctors who have experience to work with drug users. So in the next slides, I will give you a short overview on the drugs and AIDS situation in this region. So when you, first of all, this is the next slide shows data from our program. Yeah, this is the geopolitical situation. You see, Central Asia is surrounded by Russian Federation, by China, by Afghanistan and Iran. So you can imagine this is a very interesting explosive situation. The next slide shows this more in detail. It shows the development it shows the drug traffic area and the high prevalence of consumption of opiates, because opiates are smuggled from Afghanistan through Central Asia to Russian Federation, but of course a lot of them stay in the region, and so it's easily available, it's quite cheap compared to Europe, and is of quite good and high quality. So that's the reason why many opiate users are now living in Central Asia, much more compared to the inhabitants than in Europe. It shows again this traffic distribution, and that amounts more than nearly 400 tons are smuggled from Afghanistan to the whole of the world, but a quarter of this to Central Asian countries, and also part of them to China. We'll show this also a little more in detail. It is estimated that 90 tons of heroin are smuggled into Central Asia, and 10 to 15% of this will stay there. That means a lot of opiates are staying in the region, and that's why we have a really high prevalence of heroin users and opium users in Central Asia. This is a data of injecting drug users in European countries, and you see the highest prevalence is in the Russian Federation, but also in Central Asian countries, where it is a lower prevalence in Western European countries now, but also Eastern European countries like Ukraine and Belarus have a high prevalence of drug use, heroin users. So the next slide will show this situation regarding China. In China, most of the opiates are not coming from Afghanistan, part of them as well, but most of them are coming from Myanmar. And from Myanmar, it's in the western part of China, in Yunnan province. Many drugs and opiates are smuggled from Myanmar to China, and also to big cities in the eastern part of China, like Shanghai or Beijing, but also Hong Kong. So also China has a big problem concerning drug use and opiate use. It's estimated that in Central Asia, for example, it's estimated a number of about 400,000 heroin users in the region. In China, they are estimating 2 to 5 million heroin users. But of course, they have many people living in China, so it's still a low prevalence. But anyway, it caused them a lot of health problems in this region. Well, this is data which we got from our Central Asian Drug Action Program, the CADAP program, financed by the EU, where also Frankfurt University participated in the last years. And our colleagues from Czech Republic, they helped to collect all the data on AIDS and drugs situation in Central Asia, and they put it into some reports on this. And here you see the prevalence of drug use in the so-called narcoleptics register. That means that people who are using substances and are caught by the police or go to services in the narcological center, for example, they are registered. And that has, of course, a lot of negative consequences. But what you can see here is the development of the prevalence of drug users in this region. The highest number is in Kazakhstan, but it's decreasing. And also in the other countries like Uzbekistan, Tajikistan, Kyrgyz Republic, the number is decreasing. We're not quite sure what is happening. Are there no lower number of drug users, or are they not all of them registered? But anyway, there's a decrease of drug users in this register. There had been a lot of also problems concerning with injection of drug use. That means many people who are injecting drugs like heroin are infected with HIV. And here you see the seroprevalence of HIV in injecting drug users in this region. And it was quite high in the starting phase, especially in Tajikistan, because they have a really near, they are very near to Afghanistan on both sides of this border. Living Tajik people, anyway, the prevalence is very high, and in the starting phase with drug use, there was a very sharp increase of HIV infection among drug users in Tajikistan. But now, in the last years, it is decreasing. The same is true for Uzbekistan, the yellow one. It's decreasing quite extensive. And we are not quite sure if this is the real situation, but the official data shows a decrease. For Kyrgyzstan, there had been an increase in 2008, 2009, and then a stabilization, and now in the last years, again, an increase up to 15%. Last but not least, Kazakhstan, they had in the beginning a quite low prevalence, under 5%, like in European countries, but now in the last 2 years, there was a sharp increase of infection among drug users also in Kazakhstan. This shows now some of the measures done in the region. So to prevent HIV and AIDS among drug users, they started with harm reduction programs. It shows the exchange of syringes, syringe exchange programs. So they provided clean syringes and needles to drug users. And here on this slide, you see the number of programs. And it's quite a high number, especially in Uzbekistan, more than 200 programs, but also in Kazakhstan, 150 programs, and lower percentage in Uzbekistan, in Tajikistan and Kyrgyzstan. But anyway, there had been a lot of programs to provide syringes to drug users, to prevent them to get infected with HIV or hepatitis. The next slide shows how many drugs, how many syringes and needles have been distributed, and it is quite high number, more than 20 million, for example, especially in Kazakhstan, but also a high number in Uzbekistan, more than 5 million in syringes, but also in Kyrgyzstan and Tajikistan, they provided a lot of syringes. All these programs had been financed by the Global Fund of UNAIDS, not by the governments, but later on, especially in Kazakhstan, since some years, the Kazakh government is paying now for all these programs. So the next slide shows the number of participants in these programs, and it's also quite high number. But number of clients, especially here, the data from Uzbekistan, the yellow one, shows a very high number of more than 500,000 clients, contacts at least, not clients, but contacts in these programs. We are not quite sure because we have some ideas and some interviews we did with drug users in Uzbekistan who had been much more cautious to go to these centers, although they are named friendly centers or friendly contact centers. They say they are anonymous, but anyway, many drug users fear to be registered officially then. This is also the case in other countries, but anyway, there's a high number of drug users or participating at these programs. The next slide shows another type of treatment. Here do you see this slide shows structural changing in the treatment system. That means in all the Central Asian countries, the number of drug users who are in treatment had a little bit decreased, or at least are stable. This is a new development, so we are not quite sure, are there a lower number of people who need support, or is the system, had to say, doing it quite well? This is a slide on the drugs and AIDS situation in People's Republic of China, and you see here especially the red, dark red parts of China provinces. They have the biggest problem with HIV/AIDS. In the western part, Yunnan province, for example, near Myanmar, has the highest prevalence of HIV, but also some other parts of China. And this is, of course, a big problem. They are estimating about 10 million people who are infected with HIV and AIDS, most of them injecting drug users. But it's not clear what is the real number. But anyway, also in China, they have lots of services for these people, and they do quite good work to prevent HIV and AIDS among this group. On the other hand, you see on this picture also China has a long tradition of using opiates, especially opium, but that was caused not by the Chinese population, but by the British colonization. The British colonists forced China to buy opiates from them, and that caused a big problem in the 1930s of the last century. Many millions of Chinese had been addicted to opium at that time. Yeah, this shows a little bit some of the programs which had been supported by the European Union. This is a very short overview. These are some pictures from the Kyrgyz Republic. You see some of the programs, so drop-in centers where you can get syringes. On the right side, picture, this is from a prison. Also in some prison they are organizing treatment, but also providing opiate substitution treatment, methadone in the prison. And also on the last picture shows one of the methadone clinic in Bishkek, where you can get your methadone. So they have quite good programs in the Kyrgyz Republic. The next slide shows the situation in Tajikistan. Also in Tajikistan, they tried the best to prevent HIV/AIDS among drug users. They have also built up one treatment center, which had been supported by our program. And also in the prison system, they provided even syringes to prevent HIV, because especially in Dushanbe Center prison, they have more than 1,000 inmates, and 600 of them are using heroin, and that's a very bad situation. And so that's why they are also providing syringes to drug users in this prison. And but we also talked to drug users in the drop-in centers and asked them, where did you get your heroin from? and 90% of them told us we got it from the police. So the police are controlling these people and put some heroin into the pockets and then say, okay, you can decide whether to pay for this or to go into prison. So you can imagine it's very difficult to to deal with the situation when even the police is involved in providing heroin to drug users. The next is showing the most important type of treatment in the region. They do have detoxification in so-called narcological treatment centers all over Central Asia, in all Central Asian countries. But they also started with opiate substitution treatment with methadone, especially in the Kyrgyz Republic more than 20 years ago, and also in last years in Tajikistan and in Kazakhstan. But you see, compared especially to European countries, especially Germany, it's quite low number of people. For example, in Tajikistan, they are estimating 20,000, 26,000 heroin users. Only about 1,000 are now got methadone. In the Kyrgyz Republic, they're also estimating 26,000 heroin users. About 1,600 are now in programs with methadone, and in the Kazakhstan, it's even very low number. They are estimating about 100,000 heroin users, and only about 500 now are in those programs. Anyway, they are starting these programs. It's part of the treatment system. Yeah, here you see this picture shows the relationship between those who are using substances and those who are in treatment, especially in the Kazakhstan. It's a very low number, but anyway, the government tries to support these programs and to implement these programs, and also to increase these programs. The same is true for Tajikistan and also Kyrgyzstan, but one of the problems is that in Kyrgyzstan, Tajikistan, these programs are supported by a global fund from UNAIDS. In Kazakhstan, it's the government itself which is supporting these programs. Well, to conclude, this is the situation of opiate users in Central Asia. They are excluded from the health system other than narcology. They have narcologistic centers, but when they do have other health problems, TB, for example, or other, then it's problematic to get access to this. There's restricted access to drug addiction services and treatment, and to treatment with HIV/AIDS and hepatitis. Hepatitis, for example, is still too expensive, so very few people are treated for hepatitis C, although now there are new medication where you can really heal hepatitis C. There's only a limited number of social workers, psychologists, psychotherapists, and that's why we start with our program, because social work is a very important part of supporting and helping drug users in the Western European countries and also in Germany, but not in Central Asia. And also no accreditation system for psychotherapy, very limited access to opiate substitution treatment, and little cooperation between the different parts of medical support. So they are needed more training, psychotherapeutic methods. And we started with this Central Asian Drug Action Program to support them, but it's still needed. Well, concerning the drug treatment system in China, they also started about 30 years ago with, they have detox centers. This had been done first, only so-called detox centers, but they also had some special treatment centers run by the police and the Ministry of Justice, and there had been also some forced labor treatment centers. But since 2006, 2008, they also started with some new programs. They started with methadone treatment centers as well, and also with treatment centers for not for forced treatment, but for treatment. You can go there by yourself, and so I support it. Yeah, here are some pictures of some programs for HIV prevention, outreach workers in Yunnan province, also some educating law enforcement about harm reduction and HIV, also training of detainees in compulsory treatment centers, but they had also some lectures on prevention of HIV/AIDS and treatment of drug use. Yeah, here also there is a program of providing syringes to drug users to prevent HIV transmission. And interesting, some of these programs are also supported by police. So police officers are providing materials to the population, but also to drug users to inform them about the HIV preventive measures. Yeah, here is one outreach worker who is providing syringes, and he uses bicycle to go to some places where drug users are meeting. And this is also a treatment center or center HIV AIDS center where you can get information and syringes in Yunnan province. This shows the methadone clinic in Shanghai. When I have been working there and living there, I could visit it. They started quite early, 2008, with a methadone clinic in Shanghai. Later on, I could visit them again. Yeah, this is also another clinic in Shanghai. They are running several clinics in Shanghai, but they also mentioned that they had problems with the retention rate. It was quite high in the starting phase, but in the last years it went down, and one of the reasons might be that there's a lack of social support and social work for these clients. Yeah, anyway, there was a quite high and rapid expansion of treatment with methadone. You see they started to 2004 with some pilot project, but in 2007 they had already more than 700 sites, OST sites in more or less all over China, with more than 400,000 patients. Yeah, here see, this is the development 2011. They had been running more than 715 clinics in 28 provinces, nearly all over China. And this shows the development of the patients. But what you can see also, they had in 2010, they had about 280,000 patients, but on treatment had been only 117,000. That means they had a quite high dropout rate. And this is one of the problems they had to deal with, why there's a so high dropout rate. Because normally the retention rate in methadone treatment is quite high, more than in Germany, for example, more than 70 to 80%. So this is one of the problems they have to deal with. Yes, and there was another project supported by the German Ministry of Education, where we looked to the prevention of HIV and other infection diseases among injecting drug users in Central Asia, and the contribution of social work to the service for drug addicted patients. And this INBI-AIDS study we did already with some of our universities, which we are continuing now in the new program, our cooperation. This especially the Bishkek Humanitarian University, another university in Tajikistan, and also the Eurasian National University in Nur Sultan in Kazakhstan. So you see here, this was very important to start with our new program, because we discussed the role of social work in these services. We had some experiences already with the Frankfurt University. For example, in 2007, when I have been working there, there had been organized an international conference, Dialogue on Social Work, in Shanghai, in cooperation with the East China University of Sciences and Technology. At that time I could do also some lectures at this university. It was one of the first universities in China who educated social workers, and they had been the pioneers in China. Now there are about 350 universities all over China educating social workers. They had really a rapid development in the last 30 years. So there's a good basis, but most of these social workers are not educated to work with drug users. And also in Shanghai, there's also a pioneer project, the so-called Council of Shanghai Zhejiang Social Services. So there had been specific social services for drug users, and they also worked with social workers in this field. So Shanghai was the pioneer in this field, and that's why we also continue to work together with Shanghai experiences and experts, because we think they had the most quite good influence on the development in all over China.